But slide your thing over so you're both in it.
All right, there we go.
All right, today we are going to discuss health screening for childcare professionals. My name is Bridgette McCarty, registered nurse, and this is Molly Fidella. She is the director over at Greenwood.
So the overall goal of health observation training is a daily health check when kids come into the building to determine if they're healthy enough to stay in care for the day, whether that's for preschool for 3 hours or for a full day of daycare. And then what signs and symptoms and tools we use if we decide we need to exclude them at any point during the day, for various reasons. Obviously, we're in a different case of that right now, but so the sort of the basics. The first thing that's listed in the Virginia Department of Health is how germs and illnesses spread.
Correct. So I think if we talk about just the basics of hand washing and the basics of how we spread germs in an environment, we can spread those through coughing and sneezing, through touching surfaces, by sharing, let's say, utensils or items that another sick person may be using. So those are just some of the basic things. And the number one goal for, or standard precautions is what we call them, is to protect yourself from infection, is hand washing.
So in our daycare, in our school setting, probably the number one way and avenue of that is, like you said, through coughing and sneezing, which is why we work so hard to get even the 2-year-olds to sneeze into their elbow every time, cough into their elbow, and try to exclude them when that is the case. We sanitize toys and other surfaces as often as possible throughout the day.
And as a recommendation for that, bleach and water, is that what your
there's
facility uses?
There's lots of items that you can use, but the problem is when there's children in a setting, you have to make sure that the liquid is dry before children touch it again. So we tend to use bleach and water for that reason, because you can just spray it and leave it to dry, or wipe it with a disposable item on its own.
Okay.
So we use that on sinks, door handles, toys during the day.
So high frequency touch places.
Yes, tables before and after we use them. And then as far as hand washing, the children, well, right now they have to wash their hands as soon as they come into the building. They have to wash their hands. Anytime we see them sneeze or cough or they use a tissue or anything like that, they have to throw it in the trash and then use the tissue, or then wash their hands with soap and water before they sit down to snack, when they get up from snack, before they go outside, when they come in from outside.
And now, is it always hand washing, or are they using hand sanitizer?
We don't keep hand sanitizer because there's a lot of limitations about the alcohol content and how to safely use and store hand sanitizer in a daycare setting. So we tend to always use soap and water with disposable hand towels.
Excellent. Okay.
So.
And they've always said, do you teach the children to sing the alphabet when they're washing their hands?
Alphabet, happy birthday,
So you want
twinkle,
that
twinkle.
hand washing to be at least 20 seconds.
And they are very good at holding each other accountable. So-and-so didn't use soap. So-and-so
Awesome.
didn't even turn on the water.
And then when we talk about standard precautions, even in like the hospital setting, I know we're in a daycare setting for this, but in the hospital setting, that would be the number one thing, is the hand washing. And then if necessary, we would use a gown and gloves.
Okay.
If we were with a patient that had a certain item that requires certain contact item. But standard precautions in general, I think I just contradicted myself. Standard precautions in general is going to be basically just hand washing.
Okay.
And you may use some latex gloves. And contact precautions is going to be when you're going to be wearing a gown and maybe a face shield and some other of those items, which you wouldn't really see in a daycare setting.
The most that we use are gloves. We do use latex gloves for diapering, and when the little ones are sick during the winter season, and beyond, when we have to help them wipe their nose, we wear gloves when we do that, and then we just throw the gloves away.
Perfect. So I would say hand washing and your your standard gloves would be like the main things to kind of adhere to that standard precautions.
And because they're not always good at coughing and sneezing and covering it, when they sneeze on a surface, we always move them from the surface and clean the surface. Or, if it's on a toy or a book or whatever, we get that out of the mix before anybody else touches it. So that's germs and illness.
Well, it sounds
spread.
like you're promoting good habits with the children. You're using standard precautions. You're encouraging hand washing. You're doing it correctly, because a lot of people will say they wash their hands, but they don't do it correctly.
Right. Well, the reason that we are so particular about how they wash their hands is that we're also not allowed to use antibacterial soap because of the alcohol content. So we can't have that sitting at a sink. We have to use just regular hand soap, but it's in a pump bottle. So we, they can get the droplet on their hand, and it does lather really well, which is great for them. But that is why we're so picky about it, because we can't even use it.
You can teach them to like wash each individual finger, and also wash their thumbs.
Yep.
And even stuff like with their nails too, because they're little and they're touching everything.
Right. Exactly.
And then it sounds like you guys are already doing some really good screening for when the students come into your building.
Right. So health observation training, somebody who's on staff throughout the day, it's kind of like CPR and first aid training. There has to be a staff member who has health observation training during the entire day. So in the early morning, it's Ann Lyon. So she's there seeing children as they come in and out for the day. Sometimes if a child's been absent, she'll ask the parent, when did they last have a fever? When had they last had medicine? Did they go to the doctor? She'll ask some of those questions. If I'm the first one to see them as they come in at the preschool time, I sort of give them a head to toe, look over if they have any bumps and bruises. I ask, oh, what happened to your face? Or why are your cheeks so rosy? Or where's your coat today? Or, just to kind of gauge how they're feeling for the day. And then Mrs. Day, the owner, is the afternoon. She sees the kids when they come in off the bus and whatnot.
And do y'all have a rule, like a 24-hour fever-free with no Tylenol rule?
Yes.
Okay.
That's the general, qualification. Parents don't always follow that. Kids are pretty honest with us about when and what they've had, when they've thrown up, when they last had medicine, things like that. So we do tend to ask them point blank. We also know that fever medicine, if they're given that fever medicine early in the morning, usually by lunchtime it wears off, and we watch for that fever to come back around lunchtime, or especially after nap.
What is your protocol if there is a fever or sick child?
We separate them from everyone else. If they're tired and want to rest, we separate them on their own cot, especially if it's a daycare child, away from the other children with their own linens that they have from home. And we call the parent and ask them to come immediately. If it's a preschool child, it's usually not hard to get the parents to come immediately. Sometimes with the daycare children, it's harder to get them to come right away. But for the most part, they're pretty compliant. There's been very few times that we've had to really work to get somebody to come pick them up. So the next thing that was listed online is signs and symptoms of illness. Is on the next, because what's in here? Basic health assessment.
Key
hygiene.
symptoms.
Okay. Common communicable diseases among children. Okay.
So I would think for common diseases, communicable diseases among children, and signs and symptoms, we just talked about temperature. Body temperature is usually a good indication that they're fighting off a virus or a bacteria. Also, if they have drainage, if the drainage is clear or if it's discolored, if they have a cough, if they have a rash, if they have some other visible signs of looking unwell, like you mentioned, rosy cheeks, those would be some common signs or symptoms that might need to be further investigated.
Sometimes I have been known to call parents just if the child seems overly lethargic or, just doesn't quite seem like themselves. Obviously those physical factors that you talked about are easy to see, but sometimes
Definitely
over the
probably
course of
in
an
that
hour,
preschool age,
yes,
you can see children that have, like you said,
they're laying on the table,
lethargy,
or they're not moving like
or
they
maybe
normally
even
are,
like
or
a decreased appetite,
Yes,
just not looking like they're feeling well,
right,
or just not their bubbly self.
yes. Obviously, we have cases of pink eye that come in and out. Sometimes those are pretty easy to pick up. The problem that we always run into with pink eye is that they take them to the doctor and then they're like, oh, they gave us drops and so they're fine. And we're like, well, yeah, but they already gave it to everybody else. You know, they've
Right,
already
because
exposed the rest of
typically,
us. So
for most of us, with any virus or cold, a lot of times they're contagious 2 to 3 days before you
right.
start to see symptoms.
right.
But it sounds like what you're doing as far as isolating the child, contacting parents, keeping an active log of like what their symptoms and things are, and following through with removing them from the environment is the best thing to do.
We definitely, try to keep other families aware in the classroom. If a 2-year-old or 3-year-old or 4-year-old, whoever comes in sick or is sent home sick, if we know what the outcome is or what the diagnosis is, we tend to let the rest of the families know so that they can be on the lookout. And if they see any of those symptoms, to go ahead and keep their child home so that we don't just continue down, the path. Now, obviously, that's during a typical strep, flu,
Right.
ear infection season, and now we're in a different place. But we do try to communicate that to other families so that we don't continue to pass those things along during those seasons. So,
What about something that's very common in children, such as head lice?
we have had a few cases of head lice, mostly amongst the elementary children. We don't find it as much or as frequently in the preschool children. And it's really hard to exclude because the schools have gotten more lax about whether they exclude or not with head lice. So we don't have a lot of dress-up clothes anymore for that reason.
And you're encouraging children maybe not to share the same hats and
they
things
don't.
like
We
that.
don't have any hats for dress up and stuff like that anymore. During the winter seasons, when they do bring their own warm items from home, their things are stored separate, whether in a cubby or separated from each other on surfaces. But that is definitely hard. We did have a struggle with that last year.
It seems to be a seasonal thing, but there are preventative measures you can encourage families to check their child's head. You can do the preventative shampoos and things just like before an outbreak even happens.
Right.
But I think most moms and dads are aware of that. Like you said, it's more common in the elementary school age.
It is. I think it's just the length of the day that they're together. I don't know. I think the other difference in our building is that the kids, anybody who does sleep or lay down or whatever, they have to be a certain distance apart when they are sleeping and laying down. So that cuts down on some of that transmission as well.
So you're already doing what we call social distancing.
Exactly.
That's already part of your practice.
Before it was a word. Yes,
Before
we were already distancing.
You were already distancing.
We were ahead of the curve.
Protecting children.
Yes. I think those are sort of the main items that we see. Maybe once in a while we see fifth disease. It's pretty easy to pick up on.
Or the hand, foot, and mouth.
Hand, foot, and mouth. We had a terrible time with hand, foot, and mouth within the last year. And same thing, it just transmits before they're symptomatic. And so, it takes a while to get a lid on it. And the other thing we learned about hand, foot, and mouth is that everybody's symptoms are so different. Some kids end up with the terrible mouth sores and other kids get no mouth sores. And other kids only get the hand sores or only the foot sores. And so it's really hard for families to know whether they've had it or not. But we got better at it. And again, we just really worked on the hand washing and...
Back to the basics.
Yes.
That's what we say, back to the basics.
Exactly.
All right. Next topic.
Says how to conduct a health observation and check. So that was kind of what we talked about already, just on arrival, just a
you already have
head-to-toe
a plan in place to do the informal head-to-toe assessment of each child.
Yes.
And then being with their main teacher, the teacher would recognize, Bobby's very lethargic today or not acting like himself.
Right.
Maybe we should take his temperature or, look and see if there's anything going on with him from an illness perspective.
And sometimes we'll even, sort of take that child to another room and ask another teacher, do you think this is normal? Do you, sort of get another opinion? And maybe at the end we can talk about what's changed with COVID and the health and observation checks that we're having to do now. And, even just to enter the building versus what we used
We
to
could just do it now.
So right now, what we're having to do is the staff are having their temperature taken on arrival every day, just like you all at the hospital. And the children are only being dropped at the door. So Anne is greeting them at the door, and
So no parents in the
no
building.
parents in the building at all.
Which is important because we've seen, not that I'm a statistical expert, but there has been very, less cases in children under
Yes.
the age of 20
Yes.
than in the adult population.
Yes. So Anne sort of looks the child over at the door and asks the general screening questions, whether they've had a fever, have they been around anybody who has been exposed to COVID or anything like that. And then Anne takes their temperature when they arrive every day. And early on, maybe at the end of March, before we closed completely, we did have a child who arrived with a fever, and they did send him home.
Good.
And then she is keeping a log of those temperatures every day, and then I think they take them again during the day, just to make sure that there's no change in that throughout the day.
Are there any screening questions? I guess if the parent's not coming to the building, it's just the child.
The parent brings the child to the front door, and Anne greets them at the front door. And so Anne is able to talk to the parents at the front door every day.
Okay.
So whoever opens, and going forward, it'll be the same if we go back to having preschool at 9:30. It'll be whoever greets that family at the door will ask the family those screening questions.
Yeah. So
have you had a fever? Have you not felt well? Have you been around anybody?
Anyone with COVID-19?
Right, exactly.
Yeah, that would be the main things, because those are the questions we're asked every day when we enter the hospital.
Yes.
Yeah.
The good news is it seems like that's a pretty general protocol across the board.
Yeah.
Everywhere now, because even when I called and made Avery's appointment at the doctor, they asked whether she had any, same
the dentist, the orthodontist,
Exactly.
everybody's asking those.
So at least everybody's used to it now. Then it says when to exclude or include children. And obviously, right now fever and exposure are sort of the biggest things. Sometimes, we'll notice, that fever look or those glassy eyes, or, the other time that we'll send somebody home is if they're coughing so much that they just seem uncomfortable, or their nose is running so badly that they just, especially with the 2-year-olds.
Making it difficult for them to get through the day. It's just hard for them
to function.
Right.
Obviously with stomach issues, vomiting, anything like that, we do have specific criteria on vomiting and loose stools and when we can exclude, for those reasons too, for the same reason, because it's just so transmissible.
Correct.
So,
I think we talked about.
Yeah.
I know you guys, just to go back to transmission, I know you all do handle food of the students. What are you guys doing for food safety?
So up until COVID, for the children who bring their own breakfast in from home, and they sit on their own at a table to eat their food, and the staff member helps them open anything if they need it opened, and the staff member washes their hands before and after. When the child is done, they get help putting things away for the day, and then wash their hands when they're finished eating, and then they bleach the surface.
Okay.
For morning snack during preschool time, we bleach and wipe down the table. One staff member sets out the snack for each class, and they use gloves when they put the snack out for each child, and each child's snack is put on their own napkin with their own items and their own disposable cup of water. So there's no worry about,
sharing.
There's no sharing.
Yeah.
No, it's all, set on their own napkin. They have to wash their hands before they come to the table. They eat. They're not allowed to share food at the table or touch anybody else's food or anything at the table. Once they sit at a spot, that's their spot. They can't see more Fruit Loops over there and move over there. They have to stay where they sat down in the first place. They throw all their own snack away and then wash their hands again. At lunch, I was the one who opened all the lunch boxes because they all came from home. So I was the only one to touch anybody's food, and I would open their items based on what I thought they would eat for lunch, so that it wasn't multiple teachers touching their food during the day. And then we would encourage them to open their own food. if they needed something additional to eat, we would try to get them to open it themselves, and then we wash our hands after we touch anything of theirs, and then they close all that up and put it away for the day. And then same procedure for afternoon snack as lunch. They eat their own food out of their own lunchbox. One teacher opens everything. Now, since COVID started, we are not providing any food. They're eating only food brought from home in their own lunchbox that's kept in their own space at their own table.
Got it.
It's not going on a shelf near each other anymore. We're not providing a morning snack. They have to bring a snack from home in the morning, and they eat it in their own space at their own table. Same with their lunch and same with their afternoon snack. So there's even less contact with staff and anything else. And the staff members are using gloves and hand washing if the child needs help with opening anything, but they have asked parents to send things that the kids can open on their own.
Gotcha.
So that's going to be the other, I think, big change, is that we probably won't provide food anymore, just because it's just one additional level of transmission versus what's coming from home. But then we're also bringing things in from all those homes. I don't know. What do you think about that?
Like backpacks and things?
Well, so if they bring food from home, that's bringing in, obviously the child's bringing in their own germs from home, but now they're eating items from home too that somebody else has touched. Versus if we provide the snack from our kitchen, we know what we're giving them.
Right. Well, I think at this point, in terms of COVID-19, they have said that it's not food transmissible.
Okay.
So
well,
I think that I think we can still feel some relative safety there. And it sounds like you're doing a really good job of keeping everything contact free as much as possible. So I think that's all that you can expect, other than maybe wiping the outer surfaces of lunchboxes or something like that.
Right. And the way that sort of we came up with to get around having to do that constantly during the day was, and this is just, I think it's going to be the same in public schools. If they're expecting them to sit in their own space for the day, like we have the children spaced out at tables right now in the room, and they basically stay in their space at the table for the day, other than when they get to go do another center or whatever. But their lunch is kept in their bin with their crayons and their markers and their paper and their books and everything that's theirs for the day. So nobody else is touching that lunchbox or their food. It's just theirs. So fortunately, we were never a center that was doing food prep for lunch. They were always bringing their own food from home. So that takes that out of the
equation.
But, what else was on there? Basic health assessment. We already talked about that. It's weird because this book is in a different order than what they have on there. So it says importance of health policies and procedures, which that's not even in there.
This is talking about communicable diseases. I mean, we haven't talked about emergencies yet.
Right.
We've talked about some commonhood childhood illnesses in terms of the flu and strep throat and some of the hand, foot, and mouth, fifth disease, stomach viruses, and how your facility handles that.
Right.
And then, of course, now we have COVID-19 to add to that list.
Right. I think with the policies and procedures, I think we talked a little bit about that, just with knowing, when are you going to make that phone call that they need to stay home, and how are you going to set those screenings at the front door to know whether they're even...
Yeah, I think the biggest thing is just communicating your safety guidelines for your facility. So what the Virginia Department of Health is requiring, and then what your facility is doing over and above that.
Is that what they're doing at the hospital too? So as for staff that comes to the hospital, if you can't answer any of those qualifying questions, or
if you have a fever or if you've been in contact with someone, they will send you home.
Okay.
And then we also have a limited visitation policy. So at one point we allowed no visitors, and now we allow one family member per patient per 24 hours. So you can only go to see your family member, the same person, for one 24-hour period. And then next day, then a different person could come. Okay. So you can't have two different people there at the same time. to help prevent the spread. Of course, hand washing and all those standard precaution types things as well. So,
And do the visitors have to wear masks?
yes.
Okay.
So everyone is screened when they come in the building, and then they're given a wristband.
Okay.
And based on the color of the wristband,
it's the date that they visited.
The date that they visited,
Okay.
and they're given a mask, a disposable mask.
Okay.
So
for us, it should be okay for us to still keep parents out of the building, only because even when they do come in the past, it was just to basically help their child put things away.
mm-hmm.
Other than that, they don't really, like, we don't have very many parent volunteers or anything like that, except for parties and things like that. But so that shouldn't be an issue as far as visitation and things like that.
If you wanted to go that route, like later, you could do something similar, like requiring a mask and requiring like the same parent per 24-hour period or something like that. Like you couldn't have 3 family members in.
Right.
You want to make it very...
Even I was just thinking about tours. Like I had somebody call today that wants a preschool spot, and so she wants to come visit. And so I said, I'll have to call you and we'll set up a time because you'll have to come after the children are gone for the day.
Probably after the children are gone, and probably wear a mask, you know?
Okay. That, yeah, I mean, so...
And also screen that person.
Right, because nobody's going to want to put their kid in preschool if they can't at least see the building.
Screening questions, temperature check, mask, look at the environment.
And so then, you know, during that enrollment period, we'll probably also want to think about limiting the number of people who visit in a day just for the sake of minimizing
risk.
Exactly.
So you, whatever that number might be, but you might say we'll only do 3 tours a day or something.
Okay.
You know, however you and your director or owner decide y'all want to set it up. I think that's what we're doing at the hospital to minimize risk, so it would seem feasible that you'd want to do that, carry that over, whatever that number might be.
Right.
How many people
could come in, right.
Could come in.
And I guess same for anybody that would come in to do maintenance or work or anything like that. We would have to follow the same qualifications, and probably best to have them not there when the children are there. You know, sort of use those other hours for that. I think
in our, in the environment we're in right now, the biggest thing that we can do to protect ourselves is physically distance each other, and then also do the screening and the hand washing. So if anyone's coming into your space, you should probably do the screening, temperature check, questions, mask, stay 6 feet apart.
Right.
Even if it's the air conditioning guy.
Right. Yeah, no, that's what I'm thinking.
Yeah.
I mean, they, like the fire department comes in at a certain time of year. And,
right.
There's not a lot
and
of visitors. And
as long as the governor is still mandating that we wear masks indoors, then I think it's reasonable that anyone that's working on your facility would follow those guidelines.
Right, because we fall under a business.
Yeah.
So technically they should be wearing a mask when they come to visit a business. Okay, that makes sense. I mean, that's definitely going to be different going forward than it was in the past, because we would just, just ring the doorbell and I'll come open the door and come in for a visit. And, no, that's not going to be that way anymore. So, let's see, we talked about hand washing, cleaning and sanitizing, diapering. I just read, actually the other day, that the CDC does not feel like childcare needs to be overly concerned about diapering and the transmission through any diapering process. So that was a relief to read, because I thought, oh, well, that will be great for daycares to take into account next, is how are they going to do that?
Right.
We talked about common childhood illness. I don't know why it said immunizations online, because...
I mean, you could parlay it to, obviously, before a child comes to your facility, they probably have to have their standard immunizations, MMR, I don't know what else you guys require.
We don't legally, we
school.
don't have to require anything because we're a private school. However, as our own business, we have decided that they need to be up to date on certain vaccines. And so as part of their health form, they either have to have the vaccines documented because they can't come until after they're 2 years old, or they have to have a note explaining why they've chosen not to be up to date on their vaccines. It doesn't happen very often, but we do check that on their health form when they enroll them in school. And obviously, like you said, those are the basics, the MMR and Most of them have started chicken pox by the time they come. Trying to think what others. Tetanus, so that one they get it when they're little, and then they have to have it again before they start school when they're 5. So we sort of fall in the first part of that set of immunizations, and then they have to have a whole new health form when they go to kindergarten.
Mm-hmm.
So then when we have school age kids, they have a different form.
And I'm assuming you have a file that keeps track of all of everybody's immunizations.
Anne is outstanding at keeping their files in order because social services does go through those files when they come. And so, yeah, each child has their own, obviously, registration form with parent information and whatnot. They have a blue health form that would go with them if they went in an ambulance, explaining any allergies or anything like that. And then their health form, their medical form that their doctor has signed, and includes their immunization records. So,
and then just to go back to standard precautions and talking about some of the OSHA standards, obviously standard precautions is you're going to treat everyone like they may have something infectious. You're going to do the hand washing like we've talked about. You're going to wear gloves if you're going to be possibly in contact with blood or bodily fluids. And then if something like a surface gets contaminated, then you're going to use, like you said, your bleach and water. Let that air dry for 2 minutes and make sure that the surface is actually sanitized, not just cleaned. So that would be kind of your plan for limiting exposure to blood and bodily fluids, and protecting the staff as well as the students. Is there did I miss anything on that?
I don't think so. I mean, we have very few bloody noses, and typically I am the one who handles those when they happen with gloves, and I just sit with the child until that's done.
Or
with
if
a trash
someone
can.
cuts their knee on the playground or something.
That's a tricky thing because that falls under first aid and the first aid and CPR training. And typically, what we do is we sort of assess the severity of the injury, and they'll send them in to me, and I usually clean it with soap and water and cover it with a Band-Aid. And if I feel uncomfortable with where it is, then I call the parents and I take a picture of it and I ask them if they want to come get them and assess it themselves. It doesn't happen very often, but I can't do anything else to clean it other than soap and water. That's all I'm allowed to do for them. So if I don't feel comfortable with that, then I send them home. The guy that does our CPR and first aid training, he always says, when in doubt, send them out. If you don't feel comfortable with what you are trying to manage, call 911 or call their parents. Usually call 911. I've only had to do that a couple times. But as far as vomiting, when that happens, that's almost worse in our building because it is hard to dispose of the surfaces and keep it in a trash can and then dispose of all of it at once. That's why when we do get a stomach bug in our building, it is really hard to keep it from spreading because they typically throw up somewhere and it's too late. It's already touched something else. But whoever is, handling that, it's gloves, and we keep Lysol in the building, the aerosol Lysol, for those kind of situations too, just because it does seem to be a quicker, clean and overall disinfectant than bleach and water. But I don't think that, as far as other bodily fluids, we don't have much more than that.
But it sounds like you have a protocol of what to do. And if you had something bloody, you have somewhere that you would put that, or a soil, you have somewhere that you would put that. There's a brief mention of MRSA, which is basically resistant Staphylococcus or aureus bacteria. It's very common. It's like staph is on everybody's skin. Typically, that's transmitted person to person. And it's usually if you come into contact with like a contaminated item or environment. It's very common in the hospital. We do a lot of preventative things, but in a daycare setting, I think it's probably just being aware of it and seeing if there's a cut on their knee that's not healing, that's looking like it's infected. You're probably going to want to encourage the parent or whoever to take the child to the doctor. And see if if there's anything more serious going on.
I was going to say, what would we look for? Just because it is so contagious.
Just like oozy pus, like just very red edematous skin, things that just that don't look like healthy skin tissue.
Okay.
Something that just really stands out,
Okay.
or something that's like not healing.
Okay.
Would be, again, I don't think it's super common with young children. One place I can think of is like the swimming pool.
Right.
Is coming to mind, where you can get a staph infection pretty easily. You cut yourself on the concrete and then the germs get in there, and then it just sort of festers and doesn't get better. Or like locker rooms, that those types of things that daycare children really aren't going to be exposed to.
Right.
But just being aware of it.
Yeah.
And it can be a mild infection and it can be really serious.
Yeah.
So I would just say things that aren't healing, things that are kind of festering, they're not looking like the skin tissue is getting better.
Okay.
Normally when we cut ourselves, you get that first layer, you get the scab, those are all things that it starts to itch. Like those are all signs that like things are healing. So if you're not noticing that, you see it's, pussy or oozing like discoloration, drainage, they need to follow up with the doctor.
We tend to keep
Get
anything
swabbed,
open,
make sure nothing's
covered.
And,
so
and
if they're
keeping
in
it
the
covered,
building,
absolutely.
We tend to keep a Band-Aid on anybody who has any sort of cut. I mean, they'll come to me with a hangnail, and I'm like, well, it probably doesn't need a Band-Aid, but okay, let's cover it up.
Basically, keeping their hands clean, covering the wound, not sharing items, which y'all are already not doing.
Right.
If it looks like it's unusual, then you need to report it, and the parent needs to follow up.
Okay.
Can't have something that's just.
I mean, sometimes it's even just bug bites. Being the
they
way
can
our
get
playground
infected.
is.
They can
exactly.
get infected.
Somebody will over scratch a bug bite, and all of a sudden it's bleeding everywhere. And
Yeah.
some of these kids, it takes forever for those
and
things to heal.
you may have to get on a little antibiotic if you get a little skin infection from scratching, mosquito bites.
Mm-hmm.
That's very common. I think my own kids have had that happen. Where they've had to go on some Augmentin because they've given themselves a little staph infection.
Right.
So I would just, that would be my advice. One, keep it covered, but if you notice it and it looks like it's festering and pussy and drainage and yucky and not healing, then for sure.
The other thing that we see a lot of from time to time are just hives. I've had several kids in the past couple of years that have, they just come to me and they're like, I'm really itchy. And, I look at their torso and they're covered in hives. And I'm like, and both times it's ended up being a reaction to an antibiotic that they're on. But that's the other thing that I see a lot on them, because it just kind of happens and then they start complaining about it. And it's never gotten to where,
it's like affecting their airway.
Right. No, it's never gotten to that point. Because most of the kids that are in the building, well, first of all, we don't take kids that have any anaphylactic allergies at all. And we don't serve things that would tend to be an allergen like that. But yeah, like I said, these were both antibiotics that the child was allergic to. But what I just called the parents and was like, listen, they're really
just like
uncomfortable.
Your first aid
They're super
said,
itchy. Yeah.
When in doubt, send them out
Yeah.
because you wouldn't want to be responsible for that. And it could be something like idiopathic hives where you don't really know why. My son suffered with that, and he had to go see an allergist. So, but hives are definitely scary because you don't know if they've just all of a sudden touched something and it's gonna progress and get worse.
Right.
And I know as a teacher, you don't just have a bunch of Benadryl sitting there that you can just medicate the child.
Right.
So for sure, call the parent.
Yeah, we can't administer any Benadryl, so that makes it even tougher in those situations. So, did we cover?
Do you think that I think we talked about the exclusion criteria, emergent situations. You said you've had one or two, and you're just basically going to call 911, call the parent.
Twice.
If there's a choking issue, or y'all first aid trained with like the Heimlich maneuver?
Everybody is first aid trained, CPR and first aid for infant and child.
So, and then if there was ever some issue with CPR, you have trained staff there. You're always going to worry, airway, breathing, circulation.
Right. The reason that I've called for both children has been almost like a seizure behavior. We don't know if that's exactly what happened, but two different children, but they both just kind of went limp. Like they were breathing, but their color was bad. They weren't really responding coherently, and
Right.
I called 911 both times only because I didn't want it to get worse and then us to be further behind if one of us had to start administering CPR and first aid.
Sure, and the EMS staff can always assess. They don't always have to transport.
They were there within 3 minutes.
Yeah.
It was so fast, and I'm glad I called both times, but it wasn't any, it wasn't a specific injury or something that happened really fast. It was something that, because we spend so much time with the children, we were able to quickly look at both of these children and be like, okay, no, this is
something's
not
not
normal.
right.
Something
Yeah.
is not quite right. And whether it was just a low blood sugar situation or
Febrile seizures are really common
Exactly.
in children with just like
Exactly.
if you have a temperature,
Yep.
things like that. But again, better to be handled by the medical professionals.
Yes. Yep.
So
I think there will definitely be more that we learn,
you
in
may
the
need to
next
do
weeks
an
and months
addendum,
about COVID.
like
Yeah.
a COVID-19 addendum.
Right.
But for Greenwood Country Day School, preschool, I think we've kind of covered the basics of
Just
health
daily
observation,
yeah.
Best practices, and talked about safety and everything. It sounds like you all are doing a really good job.
Hopefully, that's the goal. All right. Thank you.
All right. Thank you, guys.
Thank you.